Emergency rooms busy treating coronavirus patients. A local orthopedic office is making sure that they're there for the community when accidents happen. To do this, they've transformed their office into a pop-up urgent care. Western Mass News reporter Sabrina Riley has more.
The entire medical community has really banded together to try to help each other out. I think our effort to start an urgent care is our piece of this puzzle.
No matter what field of medicine you're in, a message of "we're all in this together" is being spread. Dr. John Corsetti is the director of New England Orthopedics in Springfield, an office that is operating much differently than they were before the governor's mandate to cease all non-emergency surgeries.
Our volumes went down by about 2/3 in terms of the patients we see in the office, and our surgical volumes went down to essentially nil. We're really not doing much, if any, surgery at this point, just emergencies.
And while injuries in general are down,
kids aren't in school, sports aren't going on, people aren't playing soccer and injuring themselves.
And they tell Western Mass News it was important to them that patients had a safe place to come in case accidents happen.
We've opened up an urgent care center here at New England Orthopedic Surgeons at 300 Burney Avenue. We feel as though keeping patients out of the emergency room is paramount now. The people in the emergency room here at Bay State have a lot to do with the virus, taking care of those patients, and we certainly want to reduce the risk of disease transmission to patients with other injuries.
To ensure their offices don't aid in the spread while providing essential care, precautions start at the door.
Patients can come directly here and be checked in the waiting room, be brought directly to a room with essentially no wait, and be seen for their injury promptly by an expert provider.
He adds that when patients do take a seat, their chairs are spaced 6 feet apart and every surface is cleaned promptly after use.
Patients seem to love it. They walk in our door instead of waiting 4 or 5 hours in an emergency room to see many layers of providers often. They come into our waiting room. They're seen by a nurse who walks them directly into a room. X-rays are taken and they're seen by a provider in very short order. So the waiting time is a fraction of what they would expect in a traditional ER.
And while he hopes these changes are just temporary, they are prepared to maintain them as long as needed.
I think it's important to understand you can come and be seen here for your injuries with minimal to no risk.
In Springfield, Sabrina Riley, Western Mass News.